Moving into the panel discussion portion of today, it is my pleasure to introduce our great lineup of panelists here. This lineup includes, again, Steve Chazin, VP of Products at Alarm.com, Mark Francis, Chief Digital Health Integration Officer at Electronic Caregiver, Matt Johnson, CEO of EarlySense, and Randy Kellogg, President and CEO at Omron Healthcare. Steve, can you take maybe the next minute or so to tell us a little bit about yourself and what you do at Alarm.com?
Sure. Thanks, Kristen. I appreciate it. And thank you for inviting us to the summit. I'm Steve Chazin. I'm Vice President of Products for Alarm.com. I look after our partner tools and our business intelligence products, which is sort of the back office of our partners, helping them run their business, as well as our wellness and next-gen technology product lines. We have been around for 20 some years, most notably in the home security, home automation space. What brought us sort of fame in the segment was we were the first company to put a connected device into the security panel itself. So we could get signals out of the home, even when the homeowner wasn't arming their system. Most people benefit from a solution when they arm it. And if they have an issue, there's a caregiver or a professional looking over their homes. With Alarm.com's technology and the signals streaming out of the home, we can build a model of what's normal or expected behavior. And so we alert on unexpected trends that the homeowner might not even be aware of. About 10 years ago, we took that same platform, increased the AI that is sitting on top of it, and now we started looking at trends for the well-being of a person at a distance. This screenshot of our wellness awareness platform gives you an idea of what we do today. We can look at those same sensors that are in the home, door window contacts, bed sensors, motion sensors, and gauge the understanding of what's normal, what's abnormal. In this case, someone's taken too many trips to the restroom. That might be a pending urinary tract infection. So this is something that we've had for many years. We're one of the, I think, the only platform that is at scale that provides this. And we're extending this through our whole set of networks and dealers to make it even easier. What we know is that people are very busy, and we want to make it so simple that they just have the service running on the back end, making sure that the people they care about are okay. And if we detect something that doesn't seem normal, we'll tap you on the shoulder so you can engage.
Yeah, very, very interesting to hear, Steve, and thank you so much. Mark, can you tell us maybe a little bit about yourself and what you do at Electronic Caregiver?
Sure. Thanks so much. And I'm delighted to be here. Mark Francis. I wear two hats at Electronic Caregiver. I'm our Chief Digital Health Integration Officer. Also recently started operating as our Chief Product Officer as well. In these capacities, I obviously work on our product roadmap and product development with the team there, work in terms of the strategic initiatives, and then also work on our IP portfolio as well. Electronic Caregiver, we were founded in 2009. We are a company that is a digital health technology and service company. We're in the midst right now of hiring 120 folks to staff up a clinical triage center to enable us to really go end to end from analytics and enrollment to modern technology, through health coaching and care coordination on the back end. So that gives you a sense of kind of who we are. We're US based, although last year we did set up a ECG Europe subsidiary, and we're starting to get traction in that part of the world as well. So again, thrilled to be here and look forward to a really exciting conversation.
Thanks, Mark. We're very happy to have you here as well. Matt, can you maybe tell us a little bit about yourself and what you're doing at EarlySense?
You bet. Yeah, Kristen, thanks for having us, and great to be on this panel with the rest of you gentlemen as well. So Matt Johnson, I'm the CEO of EarlySense, which is a medical device company that makes a novel sensor that without any contact or involvement from the patient obtains the heart rate and respiratory rate and motion data of a person so that caregivers can provide insight and care for that person without requiring very much. So we make a novel sensor, this invisible sensing technology that slides underneath a surface. So picture kind of a bed or a chair or a sofa. And we've monitored a few million patients this way. Now the standard of care in hospitals, and our latest innovations have brought us out of the four walls of the hospital and into the home so that people can monitor their health, and more importantly, their remote care teams can have insight before a person has a deterioration event. So the whole goal here is to have an ultra high, even automated compliance and adherence solution that requires no interaction from the patient, nothing to wear, nothing to do, that gives remote caregivers enough insight that they can take action with that hospital grade data before a person deteriorates.
Yeah, thanks so much, Matt. Very, very happy and excited to hear more about kind of your solution, what you guys are up to. Randy, can you tell us maybe a little bit about yourself and what you do at Omron?
Absolutely. Thanks, Krista, for having us on today. Great panel. I'm Randy Kellogg, CEO and President of Omron Healthcare. I think a lot of you are familiar with Omron and probably have one of our blood pressure monitors in your home or have used them in the past. We've been the #1 recommended blood pressure monitor by pharmacists and physicians for many, many years. Been in the market 40 years, trying to help people with their heart health. Recently, and when I say recently, I'll say just before the pandemic, we made a venture into the remote patient monitoring area, launched our Vital Sight system, which is a remote patient monitoring platform for hypertension. As many of the other speakers talked about, we're trying to make things very easy for consumers. We're trying to get blood pressure monitors to more people, and we're trying to get that data back to the physician so the physician can actually take action on it, and he or she can recommend different things to the patient and maybe even help the patient before they get really sick. So it's really exciting to be here today to talk with you guys, and I look forward to the conversation.
Thanks, Randy. We're very happy to have you and definitely looking forward to hearing what you all think about some of these exciting new trends hitting the market. So yeah, let's dive right into our panel discussion. So I do have this, I think, burning question for all of you guys, kind of asking about how the business models for home health and health at home have really changed and evolved over the past few years. I know we've seen a lot of new partnerships emerging. We're seeing some new trends on the business to business side and on the business to consumer side as well. So Randy, you mentioned kind of the Vital Sight program and some of the exciting things you're doing. Why don't you kick us off?
Sure. Business models have changed dramatically in the last 4 or 5 years. It started with the recognition by CMS that chronic disease management needed to be managed better so that they could keep people out of the hospital, keep them taken care of. And that's just accelerated through the pandemic, and it will continue to accelerate as we go forward. It's really important, as I mentioned a minute ago, to get the data back to the physician. So we need to close that gap between the physician and the patient. Bring them together, bring them closer. You shouldn't have your blood pressure high for months and months on end while you're waiting for your next appointment with the doctor. You should have your blood pressure monitored all the way through the process, and maybe within a couple weeks of starting medication or diet or some other plan, you're actually having conversations with your doctor and making a change in your blood pressure. So we've just seen more and more of that happening, and partnering with the whether they're clinicians, healthcare systems, insurers. Everybody recognizes that with 116 million patients in the United States with hypertension, 1 out of every 2 adults, there's a lot to be accomplished, and we've got a lot of things to do, and time is not on our side.
It's certainly nice to see the business models finally aligning behind the science on this. Matt, what are some of your thoughts? I know Early Sense, I think, had a bit of a pivot originally, if I'm remembering correctly. You guys started in the B2C space, and then you're now in the B2B space, kind of working in the hospital and branching out, as you said, into the home. Can you tell us a little bit about how kind of the business models have changed?
Sure. Yeah, no, happy to do so. So first focus of the company was making every hospital bed on the planet smart. I think we're well on our way toward that goal with some of our partners in the hospital space. And as we think about the home, I mean, first of all, everything Randy said is of course exactly right. This is an urgent problem. It's massive, and chronic patients require this sort of care and attention in order for us to improve these health outcomes. And so what we're seeing more and more of is a kind of an evolution in the way that people think about risk when it comes to care in the home. So early iterations of these models were highly transactional, and we would see care in the home be engaged through a home healthcare company or a remote provider that provided visits. as well, was kind of the 1.0 version of the model. And now we're thinking about that differently. So we've sort of disintermediated the model to say, how can we find and identify the highest risk for high need patients within a population? And then once we've identified those patients, how can we engage those people in a way that is appealing to them, in a way that they will embrace and stay committed to? And then finally, how can, as clinicians, how can we manage those patients longitudinally over a long period of time, with the goal of keeping their chronic condition at bay, and not allowing that condition to become acute. And so often, also kind of to Randy's point, this requires hospital grade data, so that we can make really confident clinical decisions without being at the bedside. And so sort of those combination of factors, I think, have contributed to the evolution of the model.
Mm-hmm. There's certainly a lot of, I think, new opportunities emerging as well. Mark, what are some of your thoughts?
Yeah, this is a great topic, and Matt and Randy were spot on in terms of how they've seen the market evolve as well. To me, it's interesting. It's almost like a little bit of a back to the future. The first time I got involved in this industry was 20 years ago with a company called Health Hero Network. Got again involved 10 years after that with Intel's digital health team, and now with Electronic Caregiver. During that evolution, you've seen technology evolve, the technology infrastructure evolve, both the providers and the patients or consumers becoming much more willing to adopt and use digital health type solutions. As just mentioned, the integrity and accuracy of data is hugely important if you want the providers to be able to take and act upon this information. And now we really are seeing a number of different business models popping up on the consumer side. Some really interesting partnerships. For example, John Hancock Insurance is partnered with Apple with the Apple Watch, and you can use the Apple Watch to monitor heartbeat, heart rate, steps, activity, and by doing so consistently over the course of time, you can get policy discounts. On the clinical side, as mentioned, COVID was really kind of a tipping point for the industry, because a lot of some of the restrictions around reimbursement got tipped over, and now telehealth went from a nice to have to a must have, which now has been made permanent. So now we're moving to a future of hybrid models of care, which are going to be spanning from the clinical office all the way to the home of the consumer. And then there's going to be a series of different payment methods built around that to be able to drive adoption as well. So it's really exciting.
And I would certainly like to, I think, dive a little bit more into that kind of the reimbursement versus risk kind of angle. But first, I'd like to maybe dive a little bit into kind of the preventative versus predictive approaches that you were mentioning. So this, of course, this has the science has been there for a while. I'm kind of curious about how the actual business implementation of this has changed and how the market has changed. And Steve, this is really a lot of what you guys do. So definitely good to hear what you think.
Thanks, Kristen. Yeah, the sort of playing off what Mark was just saying, we can't ignore the fact that this is not your grandfather's health market, right? This is a lot newer technologies, new kinds of approaches. Consumers are paying for health devices that in the past their doctor would have had to prescribe to them. Right? They're gladly strapping on devices to their bodies in order to get a better picture of what's happening to them. So once you do that, where it's not too late, like you're not waiting for to become a patient, you're actually taking an active role in your health, and that has hopefully a remarkable effect on our futures. Most of the tools that people are buying now haven't existed for 5 years. You think about, even an Apple Watch or an Amazon Halo, a Whoop Band, an Oura Ring. The technology is now at a point where people can figure out what's happening to them before it becomes an issue and be predictive and preventative at the same time. So that's on one extreme. These are people using tools to stay healthy, which is amazing because the history of healthcare has been people getting sick and seeing a doctor for a fraction of an hour, and then taking that information and potentially ignoring it and coming back and seeing the physician again. Everything in this industry is about keeping people out of the hospital, but also being preventative and keeping them healthy. So that's, I think, one very interesting trend. The other one was on one of your slides, Kristen, the preamble to this is, caregivers who want to know what's happening with their loved ones. And if anything told us during COVID is being disconnected from the people we care about, that void is like unacceptable. Like we're all using virtual tools to stay connected with our workers and our friends and our colleagues and our teachers. We're going to use these tools, and we're starting to use these tools to stay connected to our loved ones to know before there's a problem versus after one.
Yes, I think on that slide we had we highlighted the data point on people buying solutions to monitor, I think, health and well-being. There was another data point there on people buying solutions just to be able to better communicate with their loved ones and keep in contact with them. And that was also, I think, a very, very high percentage of caregivers. Certainly a lot of demand there as well. So something else that we were just talking about was kind of the models of delivering care at home and how they really compare to what's been done in the past, and a little bit about some of the challenges around there. And I think we were talking a little bit about reimbursement versus risk and value-based care. And Matt, I know that is an area that you're paying a lot of attention to.
Yeah, we do. We spend a lot of time thinking about that. Before I had the privilege of being the CEO of EarlySense, I was the CEO of one of the largest remote patient management service providers in the United States. And so we spent a lot of time kind of parsing out those two models, and what we're really encouraged by the fact that there are interesting new highly usable reimbursement codes to encourage clinicians to participate in this process. And we think that's sort of like kind of the match that lights the fuse. Reimbursement encourages people to pay attention. Paying attention creates this long tail on chronic illness. But you sort of can't have something that is chronic, that is a generational problem, and have a transactional approach to solving it. And that's what reimbursement often does. And so what we're encouraged by, in addition to the reimbursement codes, are the creative approaches to risk that many of our EarlySense customers are taking. And so EarlySense customers are typically remote patient management service providers that are looking for novel technology to put in the home that allow them to connect to the patient and understand clinical grade, kind of medical grade patient data. And so those customers of ours are engaging and embracing risk in new and different ways. That creates an incentive for them to pay attention beyond sort of an initial transaction, a post-hospitalization, et cetera. And ultimately, I think that's the answer, right? I think that the reimbursements are welcome and encouraged, and we certainly are in support and favor them. But we think looking long-term at the ownership of risk associated with these high-risk, high-need patients is critical to really fully embracing the problem. Otherwise, the time frame or the horizon that you're looking at, something that is eventually chronic, is just too short.
Mm-hmm. Yes, definitely. I remember when I was in undergrad, we were all talking about the coming of value-based care, and that was longer than I'd care to admit. So certainly these are things that have been in motion for quite some time, with just a lot of heel dragging, it seems. Randy, I'm also interested in hearing some of your thoughts. I know you're kind of on both sides of this in terms of reimbursement and kind of looking at some of the value-based care models as well.
Yeah, and what we just heard from Matt was really good, because reimbursement is a place to start. And if we can get a start, that allows us to gather data. And then when we have the data, we can turn that into how can we be more value-based? How can we take more risk? How can we be more preventive? How can we be more predictive? It's a great launching pad for everything else. People need to be able to get access to these tools, and if there's no reimbursement, there's no access. And getting that reimbursement has allowed access for thousands of people, hundreds of thousands of people with Medicare, and that will just allow us to gather the data that will make it more potentially possible, more possible to do more predictive analytics. You have to have a lot of data to predict things, and the way to get that is to gather that data in the real world, and we're able to do that now through the enablement of these programs. So it's really important that we accommodate those people as quickly as possible, get them engaged, get them taking their blood pressure or their blood glucose or their ECG or whatever the disease state there is, and get that data brought together so we can start looking at it to make strong predictions. We know with cardiovascular that hypertension is usually the first thing that happens to anybody that's going to have serious heart disease in the future. So we're all about prevention, and we're all about prediction.
Yes, and it's, I think, certainly exciting to have finally all of this data backing up everything. There'd been, I think, a lot of movements in the kind of the pilot stage of things, but actually having everyone running these programs and getting the data builds more and more of a business case to the point where very few people can ignore it anymore.
Absolutely.
So another one of the challenges that we've known historically has come with delivering care at home has been that of connectivity. So it seems that parks, we measure a lot of times the availability of internet to the home. Of course, internet to the home has grown quite a bit in the last 5 years. Past 2 years, we've seen kind of record signups, but it still does remain a challenge, especially in maybe older consumers' homes where they might not have the right kind of a Wi-Fi setup, and just the technical acumen of different people as well. So I'm interested in kind of learning what is maybe the state of the market on connectivity, and where are we looking for kind of beyond connectivity for that next low-hanging fruit. And Mark, maybe you can talk a little bit about this topic.
Yes, sure, Kristen, happy to do so. Before jumping into that, I just want to follow up on what folks said on the earlier topic. Very much aligned with what folks are saying. The movement towards value-based care is so important. I know for us, when we work with partners, before we get started, we talk about outcomes. We want to deliver results, and to do so, it's really critically important to understand what the objectives are, to make sure the economics are aligned. And when we talk about data, what we try to do is shift the conversation from data to intelligence, because we don't want to provide data for data's sake. We want to provide actionable, curated, personal intelligence that then can be acted upon by the consumer, by the provider, and then by the extended care circle as well. When we look at the issue around connectivity, it reminds me of the old Lance Armstrong saying, "It's not about the bike." And I think that's it. We need to start thinking beyond connectivity. We've done some analysis with Intel that showed that in some senior housing communities that had become wired, that 3 months and 6 months in, you had under 20% utilization. So I think we need to think beyond connectivity and really start thinking about utility to the consumer, what applications they might engage with, and then also engagement. We can't have a bunch of siloed solutions that we expect somebody to interact with to be able to engage around their health. If you look at what CDC Director Walensky said recently, she said, most folks who had significant COVID issues had 4 or more comorbidities. So if we end up in a place where each one of those chronic conditions have a different provider, a different interface, a different dashboard, we are going to be creating a mess. So I think we need to look at this as well. While we want very, very good, competent solutions in certain areas, we really have to think about how this all comes together to be a solution, and what's going to be that enabling platform to everybody to use to be able to drive things forward.
Yeah, certainly. And I think you brought up two kind of very interesting questions here. So the first is, if you have all of these different platforms within a home, who exactly is going to be using all of them, and how are you going to learn how to use all of them? So you can have people with multiple comorbidities, of course, and each of those is going to have to be tackled. And at the same time, you have people who might already have a lot of these devices currently in their homes as their own kind of personal ecosystem. If they want to be able to share this data with the care provider, or if the care provider already has a platform, what exactly happens in that scenario? So it's going to be, I think, very interesting to see how this all shakes out. And then at the same time, we have, I think, a lot of care providers, they're not technologists. They're not prepared to drink from data from the fire hose. So it's how do you deliver that data into their current systems in a way that matches with their workflow and provides value. And that, I think, is something that a lot of very bright people are working on, but it does remain a challenge with all of the many different, very complicated systems out there on the market. Okay. So yeah, I guess any other thoughts on this topic? What are some of the kind of the big challenges you're seeing? And
I'm happy to jump in. Connectivity can either make or break a solution. If you make it too difficult for the patient to connect, they won't. So you have to work through that. And if you make your technology too complicated, they won't. We've kind of looked at the model of the least amount of work a user, patient has to do, the better. So we actually provide a cellular hub to work with our system. And you can put other things on that hub over time if you want to. The great thing would be if every house had its own hub and we could just connect to it. Doesn't quite exist yet, but maybe Steve will make it happen for us in the future. We need to be able to easily connect patients. So easy that with us, if you open the box, you take out the product, it already works. You don't have to do any more connectivity. And the other side of it is with the doctor. I think you mentioned getting the information to them. We send it to them where they want it, which in 90% of them is into the electronic medical record. We all go to the doctor now. They spend more time working on the EMR and looking at that than they do talking to us sometimes. They need that information to come in there, and they need it to be filtered so that they're not seeing 100 blood pressure readings or 100 glucose readings. They're seeing, hey, this patient is out of control. We need to take action.
mm-hmm.
Yeah, Randy, since you name dropped me, I thought I'd jump in. Thank you. Yeah, on the connectivity front, absolutely agree. This has to be so easy that you just pull it out of the box and it just works. At the same time, they're going to be the whole hospital at home solutions. They're going to require and expect a system that's reliable and consistent, even has backup. So that's sort of the world we live in. We have 10,000 dealers who can go into people's homes and install what needs to be installed. We also have all the relationships with the network providers to make sure that that data is not only available, but it's secure, which is another thing that we have to talk about when you get to health data. The way we see this is there will be, just like with home automation and home security, there will be dozens, if not hundreds, of home health products. There already are many on the market, but very few comprehensive platforms that can consume that data and make sense of it. And that is really kind of the key, because the more data points you have, the more information you're sending to an overworked medical staff. They have to make sense of it. They're going to need not just the sensors, but the systems to make sense of the sensors. And that's our business.
Mm-hmm. Yeah, and certainly just being able to integrate all of these different solutions with the EMRs, EHRs in a way that makes sense is an enormous challenge on the technical side, and then just on the human side of being able to understand kind of how all these systems are set up.
Yeah, I might just jump in, Kristen, if you don't mind, on this topic as well. I think that when we think about connectivity, it's in a bundle of attributes that these gentlemen have named, which you might call just sort of usability. And we think a lot about at Early Sense. We think a lot about compliance and adherence, and our goal, and I used this word earlier, and I use it purposefully, is that the Early Sense device, and there are others that are similar or take a similar approach, is sort of invisible to the person using it. And yeah, I think to Steve's point, there's a future state where there are health devices that we use and we rely on that are active, that are things that we engage with and interact with, and then there are other devices that are ambient or invisible that generate data, and there's a tremendous value in the technological platform that's required to make that happen, the connectivity platform required, and then the kind of the novel sensing platform that's required to sort of say, how can we are generating data as we speak. We all have heart rate, respiratory rate, blood pressure, pulse oximetry. This is all going on. We can measure these things, but how can we glean that information in a way that requires almost nothing from the person, so that we can understand their health without asking them for engagement? Because I think what we know, and we all know this from our own personal experiences, is only intermittently do we consider ourselves patients. Right, so we care about our health data when we care about it, and hopefully that's more more often than not. But that doesn't mean that the relevance or importance goes down just because it's not top of mind for us. And so that's something we spend a lot of time thinking about.
Yeah, and certainly, I think you raised again a very interesting point, kind of talking about some of the new kind of seamless ways of collecting data and just being able to get insights, and that kind of leads us, I think, to our next topic discussion topic. So let's maybe take a few minutes to touch on some of the new technologies. A few weeks ago, we got out of CES, where there's been a lot of news on new sensor tech and new innovations. What are some of the new possibilities that these technologies do open up? And Steve, maybe you can open us up on this.
Thank you, Kristen. Yeah, one of my favorite parts of my job is to get to look around corners and see the new technology that's coming down the pike. I think at this CES, it's clear that there are some trends that you can't ignore that are definitely going to be in our world in the very near future, and some already exist. I think one of them was what was just mentioned, this concept of ambient awareness, like sensors that already exist in your home in one form or another, turned into double duty to glean other sets of information from that. We're looking at Wi-Fi devices that are already being used to extend the Wi-Fi signal in your home so you have a better video call that can be used as motion sensors. We've seen radar used in phones initially and now in a bedside hub to detect how you're sleeping. Sleep tracking has itself become its own industry. I think I've lost track of the number of ways that I can determine that I don't sleep very well. Through the device I just mentioned, things you put on your body, both rings and wearables. We've seen mattresses that do this. We've seen things that fit underneath the mattress, like Early Sense. We've seen new mattress toppers. That's apparently all the rage in the Valley. All of which are just helping the end user kind of figure out what's going on with them when they're not able to pay attention, and hopefully give them some insights as to what they should do about it. We're seeing smart toothbrushes came out at CES. I have a smart coffee mug that tells me how much caffeine I drink. And I think the session after us is going to talk about a very interesting body scan, smart scale from Withings that can kind of give you the same kind of insights into your body that you might, a couple of years ago, had to go to a doctor to get. So it's super exciting. And it goes back to the idea that we're just going to see more and more of these types of technologies that are going to be part of our daily life. And all of us is going to have to flow somewhere through systems that can make sense of it.
Yes, and I went to the Withings booth at CES, and I was able to take a look at the new body scanner. So very excited to see that that hit the market. Matt, I know you also have some thoughts on this, kind of some of the new technologies coming out and some of the new potentials there as well.
Yeah, I mean, won't surprise anybody here that we're sort of generally obsessed with things that are contact free, and so we're really interested in these ambient sensors. So we think things like temperature, radar, lidar, audio, I think holds some great promise. And we're interested in invisible sensors or ambient sensors for the compliance and adherence reasons that we talked about earlier, but also because we think there's a greater opportunity to integrate those sensors into your daily life, or even to have those sensors already integrated into your daily life. And so if you take your blood pressure every day with an Omron device, what else it can be gathered or gleaned from that interaction? If you brush your teeth every day and you stand on the same mat in front of your sink, then what more can we learn? And then while you ambulate around a room, what is the cadence of your walking and the speed at which you get up and sit down? What does that tell us about your health? And then generally speaking, how can we bundle this information? And one of the major technological advancements that we're all sort of talking about here is that the machine learning that it takes to extrapolate from those basic data is really kind of sophisticated. And so how can we take that information, that kind of daily life data about breathing and your heart beating and other things, and how can we use that based on that data and then what we know about you? How can we use that to extrapolate kind of how you're doing, right? Are you, especially in a high risk, high need person's life, a chronically ill senior, for instance, how can we better understand if you're trending towards a negative health event, an exacerbation in your clinical condition? Because if we can give caregivers insights around those trends couple of days, maybe even weeks in advance, then we've got plenty of time to make sure that those chronic illnesses never become acute. And that to us, that's kind of that's the goal. That's what we wake every day thinking about.
Yes, and I think it's one of those cases where there's been, I think, a lot of very exciting research around gait analysis, around some of the other kind of analytics you mentioned. It just it hasn't quite hit the mass market yet, and I think once it does, we're going to start seeing a lot of very great societal benefits, a lot of kind of innovative new business models coming up.
Yeah, I'd love to jump in on this one as well. 100% agree with that, what everyone just said. This is a thrilling area to me, both personally and professionally. I spent the last 12 years at Amazon and at Intel working in emerging technology. So it's really exciting to seeing all this come together and being pointed into what we're doing in health and health at home. Building upon what Matt just said, taking all the different sources of data, whether it's ambient or from a direct interaction with a consumer, having the right intelligence on the back end to be able to do the data analytics, having the right algorithms, the machine learning use cases, and then the AI really then gives us information that we can act upon. We're seeing and incorporating into our products computer vision technology, because we've been doing half a decade of research looking at how do you take data that you can get from cameras for gait analysis, for falls risk, for subtle signs of potential stroke, signs of Parkinson's, even lack of stress or lack of sleep or stress as well. All different inputs that could be indicative of someone's changing health conditions. So I think that type of stuff is super important. The thing that we're doing is saying at the end of the day, we do see that there needs to be some engagement with the consumer. What's the best way to do that? We're doing that through the development of a virtual avatar. We call her Addison, and it's really built upon some top gaming engines to have a level of fidelity and interaction with the end user, so it becomes a delightful experience. The intention is to be able to engage folks in a place where they want to come back, have that relationship, and through that relationship and that extension of the care circle into their home through the virtual caregiver as well, to be able to drive better outcomes. Along that line, in terms of when we talk about access, we're talking about access to technology. One thing too, we have barriers of access to care. They might be because of a whole bunch of social determinants of health issues. So we're developing actually 8 different avatars, different races, different genders, different ages, speaking different languages, with different environments, to really be able to match what an end consumer might want, because we believe that'll lead to better engagement, and better engagement is going to lead to better outcomes.
Mm-hmm. Yeah, and certainly you can kind of customize your avatar in many different virtual experiences. So why not the avatar of your virtual caregiver as well?
Yeah.
Okay, very exciting. It looks like we have about 10 minutes left so far, and we do have some questions in from the audience that I'd like to make sure that we do address. And maybe one question for me if we have time. So first question, kind of in light of the ever-expanding role of connected health devices that can really help benefit the overall health of patients and consumers, how are these devices impacting and changing the role of PBMs in healthcare? If at all.
Well, I'm not sure they impact PBMs. They certainly impact clinicians. They impact nurse practitioners. They impact all the people that deliver care, because now they're getting, we've talked about getting a lot of information. Hopefully they're getting the right information to take action. So it should help them to better care for their patients, and to take the actions that need to be taken when they need to be taken, versus a long extended time before that action is taken.
Mm-hmm.
Yeah, and I suppose, I mean, of course, Randy's exactly right, and I suppose it depends on which PBM. We're gonna make a price list and a drug database aspect, and we're gonna sign up members. Like, not at all, but there's a long tail to certain drugs and certain interactions with drugs, and so to the extent to which the PBM is offering services over and above the kind of the most essential and basic PBM services, then I think there could be real opportunities for connectivity. You're a chronically ill patient, you're trying a new med, and wouldn't it be helpful if that med came with, along with that prescription came an Omron blood pressure cuff, for instance? These are things that I think are relevant and interesting. And, I think everyone on this call, I'm quite certain, would very much welcome PBM's entry into the space. I think from our perspective, we've seen it as tepid because the service offerings are different and a little, one or two clicks more, or one or two clicks closer to the clinical than perhaps what's been historically tried. But I think it's an interesting space to watch.
Yeah, I remember there was some interest in having smart pill bottles and other kind of compliance solutions be integrated with PBM systems. I'm not aware that that's taken off at all. So I think it was mostly interest on the side of the vendors.
I think it was more vendor driven as well. I think it's a great area for further innovation and partnership. We've seen kind of the same thing, and as we're getting better solutions that are right in that patient home to be able to do medication monitoring, medication compliance, if we could really close that circle so we can really see what's happening and have information on what that might need to be coupled with, as Matt and Randy mentioned, in terms of perhaps some monitoring, or to be able to look at adverse effects. Because if we're getting this patient-specific feedback and information on what drugs they're taking, medication mismanagement is such a major issue. Closing that circle would be fantastic.
Mm-hmm.
We don't live in this world yet, but there may be a day where the kinds of devices we've been describing that people are getting will feed into a system before you need a medication to deal with a chronic illness. And you'll be prescribed tools like this to stay in front of it versus get behind it.
Mm-hmm.
Yeah, I mean, I think in kind of there have been precedents in different spaces as well where you do have that compliance monitoring, and it is needed for reimbursement. So I can certainly see that making its way into kind of the drug space, and with PBM sort of serving as that role. So another question here.
Yeah, the first foray we've seen is the platform we put together does have APIs, so we can pull in information and partner with the Walgreens, the CVS's, the PillPack, be able to remove that barrier. We're tracking how much medication consumption is happening, if someone's coming close to needing to have a refill. So we're starting to put some of those pieces together. A lot of other folks are doing that well. I think these are steps in that direction for a more holistic approach to patient care.
Okay, so sort of something that is maybe just beginning to get rolling.
Mm-hmm.
Okay, so we have another question in saying just because you have a CPT code doesn't necessarily mean that the insurer is going to reimburse. Then asking, how do we get more insurers to really consider new capabilities that fit under today's CPT codes to be the standards of care so that they'll actually reimburse?
You have to provide the data. The CPT codes that we see doctors getting reimbursed or healthcare systems getting reimbursed for are basically Medicare reimbursements today, but the studies that are being done on their programs, whether we've done one with Northwestern, there's been numerous others out there, the data can be provided that this action saves dollars or improves outcomes or has some great benefit, a good outcome. Then you can go to the rest of the insurers and show them where this is a benefit, and they will adopt it. IDNs are already adopting it, but we can see, the Blue Cross Blue Shields of the world adopting it as well. But I wish it was a fast process. It's not. It's a slow process. You got to prove it. You got to work this system and help them understand it, and then you have to get them to adopt it and try it.
Mm-hmm.
Yeah, we've seen similar type things as well. This was a lot of our conversations in Q4 of last year. Folks had gone after some different CPT codes and some different technologies because they needed to, because they weren't getting patients to come in to their clinics or to the hospitals. And then it's like, okay, where are we now? Let's take a strategic assessment here. For example, if you look at chronic care management and remote patient monitoring, there are codes for that, but to actually be billed, you have to provide 20 minutes per month of health coaching or care coordination. Well, if you have 1,000 patients, that's 20,000 minutes per month. Most physicians' offices are running their practice. They don't have 20,000 minutes idle time to be able to do this. So then what we saw was then there was a lot of high interest, and then how am I going to execute this? And how am I going to do this as a business? So there's organizations, ourselves and others, that have staffed out the capability to say, if you want to do it yourself, you go ahead and do it. If you need us to play that role, we will play that role. And only folks that are really decompensating and need immediate action, those are the ones that will be pushed to you to be able to act upon. So I think all of us need to look at not just the codes itself, but what is required to actually be able to be reimbursed for that work, whether it's taking 14 vital measurements, after the emergency's gone per month for vitals monitoring, or the care coordination on that side. So I think there's business models around all this that are pretty attractive for providers. But again, this is also new for folks. There's some experimentation, there's some learning. And then from that, I think you'll start seeing things happening more in scale.
Yeah, I think that's definitely very, very interesting and certainly very helpful. So I think we have time for maybe just one more question before we have to go into our executive Q&A. This question is asking about kind of connectivity. So outside of Wi-Fi mesh extenders and paying more for ISP speed, are there any solutions that can help consumers to ensure that their internet connectivity is solid enough for their internet needs, for their medical needs? And then asking about 5G backup, or I guess it could also be 4G backup. Yeah, any thoughts on this, or is this sort of kind of, this is more in the consumer space, or this would be just kind of, as you guys were saying, that hub device, which would have the cellular embedded in it?
Yeah, well, cellular's a great platform, but it may not be the right platform, just one that many of us have chosen. And depending upon what data you're sending, you may be sending very small packets of data, so you don't need the greatest connectivity. You just need enough connectivity to get that data sent. So I'm not the technical guy. Maybe Steve could tell us more, but there are probably good solutions coming if they're not here already.
Yeah, in all our conversations with network service providers, they're aware of the requirement for this. And as you know, 5 years ago, this conference would not have worked.
Right.
The quality of the video and audio has gotten so much better, frankly, thanks to Netflix and other systems that put pressure on the back end to make it work. So they're aware of the requirements for this, and providers like ours have multiple ways to get the signals out. If one doesn't work, we use a different one. So there's all that built into the consideration. And we should also figure out, again, that we're all walking around with a connected device in our pockets or on our wrists. That's also a backup for the backup. So there's new ways to get that data where it needs to go. The real challenge is making sense of it before you push it into some system where too many eyes look at it and no one takes any action on it.
All right, great. I think that's unfortunately all that we have time for right now, but I'd like to thank you all so very much for joining us and participating in this very, very interesting and wonderful discussion. Very happy to have you all here.
Thank you.
Thanks, everybody.
Thank you. It's a pleasure. Thanks, everyone.